Trump says take the hepatitis B shot at 12 years old or older. Now, before the hepatitis B vaccine was recommended at birth, there were about 20,000 infections in children each year, children under 10. Now it's down to, I think, close to a few dozen. Getting that dose at birth prevents infections that can be passed down during delivery, or even if the mother is known to be negative, it also protects against infection through close contacts with other people in infancy and in childhood, with other people in the house, with other caregivers or children at daycare, and so on. I think what Trump doesn't understand is that you can get hepatitis B from microscopic amounts of blood. I get the impression that he thinks this is exclusively a sexually transmitted infection, which is simply incorrect. Certainly, you can get it from intercourse, but you can also get it through exposure to bodily fluids in many other ways that an infant might be exposed to. And by the way, about 15% of pregnant women aren't tested for hepatitis B because of not very good access to OBGYN care during pregnancy and so on. So for children that get infected in infancy, there's a 90% risk of developing lifelong liver infection that can lead to end-stage liver disease or liver cancer. And we combine that with the fact that some women don't get tested, and about half of people overall, this is an important statistic, half of people overall with hepatitis B are totally unaware of their infection status, including potential people that the child may come into contact with early in life, separate from the mother. Of course, there's also millions of data points showing good safety and good efficacy for the birth dose, and there's zero clinical or scientific rationale for why pushing it back to later would be any more safe or any more effective. In fact, it would obviously be much less effective because those 20,000 new infections we were talking about per year were in children under the age of 10. So if you're only starting vaccination at age 12, you have no protection against those tens of thousands of totally preventable infections. So this recommendation doesn't make any sense whatsoever, unless you don't understand the disease and you think the only way you can get hepatitis B is from intercourse, which is incorrect. And by the way, recommending the birth dose, it doesn't mean anyone is forced to get it. What it means is that insurance providers have to cover it if you choose to get it. And I think that distinction is often missed in these discussions. It's not that they're forcing you to vaccinate your baby before you leave the hospital. They're forcing insurance companies to pay for it if you choose to get it. And I do think it is a good idea to get it. Our daughter got it when she was in the hospital. Before leaving the hospital, there's a huge body of evidence supporting the benefit-risk profile for the hepatitis B vaccine. But no one's forcing you to get it. It being recommended means insurance companies cover it.